In this lecture, we will discuss the ST segment, specifically what it represents and how it should normally appear on the EKG. The ST segment represents the time from the end of the QRS complex to the onset of the T wave. The start of the ST segment is also referred to as the junction point or J point, and sometimes referred to as the ST junction. So if you look here, we can see our ST segment, this here in red, from the end. This is our QRS complex, right? This is our P wave. Then we have the start of our ST segment up until the beginning of our T wave, which is this point here. So this portion here is our ST segment, okay? And we said that the beginning of the ST segment, this portion here, is also referred to as the J point, or sometimes referred to as the ST junction, okay? Now this is normally an electrically neutral period between ventricular depolarization, which is the QRS complex, and ventricular repolarization, which is our T wave. The myocardium is maintaining contraction in order to expel blood from the ventricles. So if you look here, ventricular systole, okay, when contraction is taking place, right, is from this point here, okay, up until this point. So this is ventricular systole, and notice that our ST segment is within that area. And then when the ventricle starts to relax, ventricular diastole is from this point here until, again, that point. So we are in that ventricular systole area, and the ventricles are contracting and expelling blood to the rest of the body. Now, because this is an electrically neutral period, we should see the ST segment at the level of the baseline. Remember, the baseline is set by the level of the PR or PQ segment, okay? Remember, the PR segment is from the end of our P wave up until the beginning of our QRS complex, okay? And that is where our baseline is set. So if you look here and we assume this red line here is our baseline, you can see how it continues through to the other side. Notice here we have the ST segment, this portion here, at baseline. Okay, that's normal. And then you can see the ST segment depressed, and here, this region, look how it's below baseline. And then we call this ST segment that's above baseline, ST segment elevation. Now there can be some normal variation in the ST segment from baseline of up to 1 millimeter of ST elevation or depression in the limb leads. In the precordial leads, ST depression is always abnormal because that's where the ST vector is heading away, okay, and we'll see the ST elevated instead of depressed in those precordial leads. Now ST elevation in the precordial leads is often the most prominent in leads V2 and V3. In fact, it may be up to 3 millimeters in those leads. ST elevation in the left precordial leads, V5 and V6, rarely exceeds 1 millimeter, which is 0.1 millivolts under normal circumstances. And in the posterior leads, so like V7 through V9, okay, or even V10, it can be between 0.5 and 1 millimeter at the 80 millisecond point after the J point under normal circumstances, okay? So just so you're aware what we mean about this 80 milliseconds after. So remember, we have our J point at the, here, let's just erase some of this. So remember, this portion here is the J point, and when we talk about 80 milliseconds after, that means about right here, okay, or whatever two small boxes is. Remember, each small box is 40 milliseconds, so if you look at, find your J point, the end of it, and then go two small boxes over, that's 80 milliseconds, okay. They've been found at that point 0.5 to 1 millimeter ST elevation is normal in the posterior leads in many cases. Now lastly, you should be aware that certain ST segment morphologies are more common in specific conditions, and these morphologic variations of the ST segment occur when the ST segment is elevated as well as depressed. For instance, an ST segment that is elevated and concave up may be seen as a normal variation, is early repolarization, or can be seen in pericarditis, while an ST segment that is elevated but concave down may suggest an infarction or ventricular aneurysm. Anyways, just something to be aware of. We'll get into more detail in later lectures. Alright, let's briefly review what we discussed before we end. So the ST segment is from the QRS complex where it ends, okay, from the end of it to the T wave onset. All right, we said this area here in pink. The cardiac event, remember that this is an electrically neutral period between ventricular depolarization, the QRS complex, and ventricular repolarization, the T wave, okay? Remember, the ventricles are in systole, so you're contracting and maintaining blood and expelling it out to the body, okay? Now the ST segment is located at baseline normally, but there's that possible normal variation that we can see. In the limb leads, it could be up to 0.1 millivolts or 1 millimeter, which is one of those small boxes. In the precordial leads, you can see ST elevation in V2 to V3. Remember, that's the most prominent and can be up to 3 millimeters. And some studies actually show it a little higher, okay, but that's usually the upper limit. In V5 or V6, the left lateral precordial leads up to 1 millimeter. ST depression in the precordial leads is always abnormal, okay? So if you see this ST depression, something like this, in one of the precordial leads, V1 through V6, that is considered abnormal, okay? So one thing to consider. In the posterior leads, you can have up to 0.5 to 1 millimeter of ST elevation at the 80 millisecond point after the J point, as we discussed, okay? Posterior leads, V7 through V9 have been the most studied, okay? Not really V10. Now, we said the ST segment morphology can be more common in certain conditions, all right? And we said that we can have these different ST depression and ST elevation morphologies present with the concave up, concave down, and these are things we'll look at in later lectures. Well, that's the end of this lecture. We discussed the ST segment, specifically what it represents and how it should normally appear on the EKG. I hope you learned something.